Okay, I found a nerdy study. If you have watched any of my videos before, you know that I love to geek out. There's a study that claims that prices for a scan at the same hospital for the same type of scan can vary from just over $100 to $4,000. I wanted to get through, actually look at the study, look at the article, and I'm going to show you what I have found. So here's a MarketWatch article. It says, how much for a CT scan? It could be $4,065 or $134 at the same hospital, depending on your health plan. So I then dug up the study. So the study is from, the study is called Commercial Negotiated Prices for CMS Specified Shoppable Radiology Services in U.S. Hospitals. Don't worry, I'm going to break down some of these technical terms. Okay. So, commercial negotiated prices for CMS specified shoppable radiology services in the U.S. hospitals research letter. On average, as of September 6th, 2021, 2,053 of 5,700 hospitals, or 36%, reported at least one of the 13 U.S. centers for Medicare and Medicaid services specified shoppable radiology services. So hospitals are reporting data. They are required to report data now. So are health insurance companies. So we're getting some more information, and people are trying to digest it and understand the information and what it means. Okay? As compared to the Medicare rate, a CT scan of head or brain CPT code, and it lists the CPT code, had the highest median negotiated price, and mammogram CPT codes, yada blah, had the lowest median negotiated rate. Okay, so I'm going to break that down, right? They have all of these networks that they're having to negotiate with, and each of the network can have a different contract and a different amount associated with that CPT code, and it might even have a different effective date. You know, they might be signing a contract that starts today for the Saluti Moss HealthNet HMO and goes for 5 years, and then next year they sign a new contract with a new HealthNet comes out with a new network, and they call it HealthNet Kaka Network, and they have to sign up a new contract under that network, and it lasts for 3 years, and so they can be renewing it. These contracts can be renewing at different times and evaluated at different times and start at different times, and carriers change the names of these networks, and so they might get rid of an old one and replace it with a new one with a new name and a new branding strategy and marketing strategy and all this stuff, right? So there's reasons why, very plain, logical, and boring reasons why this is happening, right? There's no... Okay, so that's not anybody's fault. That's the market, okay? So, according to the study, all right, the difference between the lowest negotiated price for a common imaging service, such as a brain CT scan, varies widely, not only among insurers and employers dealing with the hospital system, but even among different health plans offered by the same insurer or self-funded employer. The highest negotiated price can be nearly 4 times as much as the lowest. Okay, I would agree with that. After looking at the study, that is an accurate statement. Can even be 10, but it's not 10 times. Okay, so they were showing 10 times or more than 10 times. They were showing like 40 times as much in the title. Okay. For instance, the cost of a brain CT scan can range from $134 to $4,065. By the way, I did not find that number in the study. Maybe I'm just missing it, but I didn't see that. And that certainly was not the average range, but the ranges were large, okay? The 75th percentile within pair price gap for a brain CT scan was 2.4, the study states, meaning that 25% of the hospital insurance company pairs had their max negotiated price more than 2.4 times their minimum negotiated price. Okay, so this is getting into percentiles. So they list the doctors or dentists according to their costs and how much they're charging. Okay, so let's say, and again, I'll use dental because it's a little bit, it can be easier for people to understand. Maybe I'll change my mind. Am I going to change my mind? Yes. So let's say on this example with the CT, with the MRI, okay, you have people or hospitals charging anywhere from $400 for an MRI all the way up to $4,000 of an MRI. Okay, so let's say that, and they start out with the cheapest hospital is listed first, and it goes lists all the hospitals all the way up to 4,000. Okay, so the top 25% is the 75th percent. So you go up that list 75%. Okay, so if you have 100 hospitals on that list, you go up to the 75th, and that is the 75th percentile. Okay, and everything above that is above the 75th percentile. That's the top 25%. Those are the most expensive 25% of hospitals. Okay, so that's the percentile. And likewise with dentists, a lot of dental plans use these percentiles, and they'll say, we'll reimburse you up to the 90th percentile according to your zip code. Okay, so that just means that of all of the doctors in your area, those that are charging above what 90% of what the dentists in your area are charging, we're not going to cover. Okay, so the top most expensive 10%, they're not going to pay above what the 90th percentile of dentists are charging in that area. Okay, hopefully that makes sense. Oh my gosh. Makes sense in my head. I don't know if I use words properly. Words are hard. Okay, so the cost of the brain scan can range from $134 to $4,065. I've stated that again and again. Okay, so we have a couple of terms here. We've got CPT code, and we've got the Medicare CMH, blah, 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 blah. Okay, so it says commercial negotiated prices for CMS. So that's just the Center for Medicare Medicaid Services. So it's a government agency, and they list every year what their reimbursement rate is for their Medicare Medicaid members. Many hospitals use this list of costs as a benchmark of negotiation with the insurance carriers. And what I mean by that is XYZ hospital will say, Mr. Insurance Carrier, we don't want to we will only accept a contract with you if you will pay 2 times the Medicare reimbursement rate. So they use it as a gradient on how to adjust their costs. So everybody knows that if the hospital accepted the Medicare reimbursement rate from all of the insurance companies and all of their cash patients, they'd go out of business. They cannot make enough money just off of their Medicare Medicaid members. Okay, if they get too many Medicare Medicaid members, they'll go out of business. And they know that they look at the pie, the amount of members they have with Medicare Medicaid traditionally, and let's say it's 50%. And they say, okay, 50%, we're losing X amount of dollars on, and we need to make up X amount of dollars. And they use that information, and they go to the insurance carrier and say, we need 300% of the Medicare reimbursement rate, or we need 3 times the Medicare reimbursement rate to do business with you, Aetna, or to do business with you, UHC, because they're losing so much money on Medicare and Medicaid patients. Okay, so that's just a standard industry term that you're seeing here. All right, and to show the CPT codes, So CPT code is a service code. It's a procedure code. And every single procedure that is approved by the American Medical Association and used by Centers of Medicare Medicaid Services has a code associated with it. Every single one. And to give you some context, I'm going to show you the equivalent to dental, okay? Because it's a much smaller list. Okay, there are thousands of codes, and every single one has a cost associated with it. Okay, so I'm going to pull up. So this is an old plan. This is like nostalgic for me. This is for those of us who've been in insurance a while. This is an old school dental plan, and just it's funny when documents bring up memories and nostalgia. Okay, it's like full on insurance nerd status here. But Golden West was the carrier for a while. They were coming in with the best plans, they had the best rates, and then Anthem or WellPoint, I believe at the time, came in and bought Golden West, and it's been a shit show ever since. Okay. But this is a very simple DHMO plan design. DHMO just means dental HMO. It's the 89L3, super classic plan, very typical dental plan. And you can see here, they've got the ADA code listed on the left. Now, this is the dental equivalent to the CPT code. Okay, so you can see it has a D in front of every single one. So that way, all the claims adjusters or all the claims people know this is a dental and it's not medical, it's dental. Okay. And then here you can see the description on the right. So this D0120 is the periodic oral evaluation, and the D0140 is the limited oral evaluation. And each and every code with a dental HMO has a copay associated with it. So you can see the copays listed here on the right. So there's no charge, no charge, no charge. And then you get down here to resin-based composite, 1 surface anterior, 2 surface interior, so on, yada, yada, 4 surface, so on. And you can see that, for example, crowns here is D2710. It's a resin-based crown indirect. It's a $50 copay. So one thing to note is that you may have multiple codes on one claim or one date of service or one visit to the hospital or one visit to your doctor. Doesn't necessarily mean that the member is just going to pay this $50. They might have had some other things done before they had the resin-based composite indirect, service, and it's going to be more than $50, right? With that said, I do this not to confuse you, but actually to try to bring some clarity to the CPT code and people just glazing over. The next section says the spread of commercial negotiated prices was the widest for a contrast enhanced CT scan of the abdomen pelvis, which was CPT code 74177, and narrowest was for the mammography, a view of the breast tissue, CPT 77065 and 77067. Okay, so those are the specific codes that they analyzed from the data they collected from these 2,053 hospitals. Okay, now this is all of the public information that they have available. So what I did is I downloaded and paid for the study because I had to know, because for me, this headline is just crazy, right? So they're saying that if you go to one hospital, okay, for the same scan, that hospital and the same insurance company, that hospital could charge $100 or as much as $4,000, right? So I had to know more. These people that did this study were interviewed, And I'm actually going to go over that with you first. So we'll get some context as to what happened with the study, what the methods used in the study, and so on. Okay, so when it comes to price negotiations for healthcare services between hospitals and insurance companies or self-insured employers, hospitals appear to be winning big time according to this study, okay, or according to the opinion of the person that looked at the data, right? The difference between the lowest negotiated price for a common... Okay, so I hate this. This just really bothers me, this winning big time. How are the hospitals winning big time? Because they have to negotiate with all these carriers. So the other actually thing that I wanted to bring up is this here. And I'm sympathetic to everyone. I'm like Switzerland. This healthcare system is very convoluted, overly complicated. So anyway, so the way I wanted to demonstrate this, so when you look at the title of this particular study, or this article, because it wasn't actually the title of the study, it was the title of the article that caught my attention, it says that depending on your insurance company, you may even have different negotiated rates even with the same insurance company, which is true. And to bring context home to this, to show you what doctors and hospitals have to deal with, and they have to have a whole staff that deals with negotiating and contracting with these insurance companies. Because I see both sides. I'm empathetic to the patient, I'm empathetic to the insurance company, I'm empathetic to these doctors and these hospitals and what they have to deal with. Okay, so this one doctor, this is Michael Harris. Okay, don't know the guy, just a random doctor I pulled up because I want to show you these different networks. Okay, so we've got Aetna Basic HMO. Okay, we've got Aetna HMO, which is a different network than Aetna Basic HMO. So you've got Aetna Basic HMO, Aetna HMO, Aetna HMO Deductible Plan California only, Aetna Managed Choice Open Access, Aetna Open Choice PPO, Aetna Savings Plus of California, Aetna Value Network, and then, okay, so that's just Aetna. That's just within California. There's other networks within Aetna. That's just some of their main ones in this particular area where this guy lives, or where this doctor is in Whittier, right? And then you've got Anthem Blue Cross California Advantage PPO, Anthem Blue Cross California PPO Prudent Buyer, Anthem Blue Cross California Select PPO, Anthem Vivity HMO. Then you've got Cigna HMO, HealthNet Community Care HMO, HealthNet Enhanced Care PPO, HealthNet Full PPO, HealthNet PPO including Covered California, HealthNet Saludi Mas HMO, HealthNet Smart Care HMO, HealthNet Whole Care HMO, Oscar Individual California Bay Area, Oscar Individual California LA and Orange County, Oscar Small Group California LA and Orange County. So this PhD gentleman, Guy Bay, I don't know if I'm saying that right. He's one of the head researchers of this PhD study. He's a professor of accounting and health policy at Johns Hopkins University and one of the co-authors of the study. He told this to Fierce Healthcare, and their findings surprised her. If insurance companies' incentives had been perfectly aligned with the employers, we would have observed little variation in negotiated rate for a given hospital across different health plans administered by the same insurance company. Okay, the insurance company, their alignment is with usually their shareholders and their customers in trying to get as many doctors as they can, as many hospitals as they can, into their network for as little money as possible. That is their alignment. And of course, they're not aligned with the other side of the table, which would be the, let's say, hospital, who's trying to get as much money from the insurance companies as possible because they're losing their ass on all of the Medicare, Medicaid, government subsidized plans, right? Because the government is only going to pay according to their Medicare reimbursement rate, and it's so low that it you can't keep a hospital open if you're taking that rate, right? So yes, they're not aligned. They don't have the same goals. I hate to break it to you. Okay, so this co-author examined the negotiated price for 13 radiology services as designed by the Centers of Medicare and Medicaid Services. Only hospitals that contract with at least 2 health insurance plans were included. The authors calculated the price gap by dividing the maximum price by the minimum price. A price gap of 1 represents no within hospital price variation. You know, it's like 100%. Like, okay, so the maximum was 100 and the minimum was 100. You divide 100 by 100, it's 1. Right? So there was no price variation. Versus if you have, you know, the highest price was $200 and the lowest was 100, that's a variation or gap, they're saying, of 2, right? 2x. So it makes sense. The brain CT price gap was the highest at 5.2. So we're saying the brain CT had the largest variation, so you might have the lowest be $100 and the highest in that with a 5.2 gap would be $520, right? Then came the pair level analysis for each service. Only hospital insurance company pairs that contain negotiated prices within at least 2 health plans operated by the insurance company in the pair were included in the sample the study found. A hospital insurance company's price gap was measured as the maximum price divided by the minimum price in the pair. They already said that, right? Okay, so they're just explaining the pairs, and no evidence provided by our study is only, okay, so the evidence provided by our study is only the tip of the iceberg. More research is needed to understand the dynamics in the price negotiation process in the commercial market. Price transparency remains a coveted but elusive target in healthcare, with both hospitals and health insurance companies getting off to a slow start with the new CMS mandated initiative. I think I talked about this in a previous video. There's these new, they came into effect January 2021. CMS is requiring them to provide all this data from both the insurance company side and the hospital side. But fines for noncompliance are quite substantial. It began July 2021. Hospital compliance has been somewhat a hit and miss, with the industry complaining that the rule put too much of an administrative burden on them in the middle of COVID, at a point where the American Hospital Association made a lawsuit against CMS that the AHA eventually lost. So the American Hospital Association lost that lawsuit. Lack of compliance isn't a problem with these insurers, who divulged their price data in July of 2022 in an avalanche of information experts still struggle to dig through, I bet. CMS knew that this could be a stumbling block and encouraged computer vendors to help in aggregating the data. Okay, I remember this. And this, so they were suggesting that, this is, it's all just codes, and computer programmers can figure all this out, right? And they were trying to solicit volunteers, and it didn't work out. So even to download one teeny tiny part of this gigantic task, let alone open the file and understand the data, just be highly expert in what you're looking at. Simon, a nationally known healthcare economist at Indiana University, is considered the expert who's taken the deepest dive into the insurance industry data. When we talk to people who have amazing capabilities in data processing, they'll say, okay, We know how to open one or two of these files, but to open all of these and make insights, that's pretty close to impossible. Employers who self-fund healthcare coverage for employees will next year have to add impetus to pay closer attention to price and quality of the plans they offer. Provisions of the Consolidated Appropriations Act set to take effect next year will make them fiduciaries of the coverage that they offer their employees. In other words, more responsibility, more power, more liability. Okay. Elizabeth Mitchell, CEO of the Purchaser Business Group on Health, recently told Fierce Healthcare that this might be a turbulent transition. There is going to be a lot of change required on the healthcare industry side, and I think it's going to be a challenge for many of the incumbents who have not had this pressure before, Mitchell said. They agreed. More skin in the game for employers means more motivated and price-sensitive purchasers in the healthcare market, which can create pricing pressure on providers. Yeah. Okay. Even more employers who are not self-insured might use price transparency to impose pressure on insurance companies for better deals or play more of an active role directly in price negotiations. You have no idea what you're talking about. Okay, so that's all fine. Okay, that's all fine. I understand people are trying to throw out ideas. I think that the study, taking a crack at this and just starting with CT scans, I think it's great. I think that this information is good, and I'm not critiquing that in any way. But this person does not understand the commercial market at all, and that's fine. They're not supposed to. They're supposed to understand their data, right? They're supposed to understand how to aggregate and organize information. They don't know all the ins and outs of the market and how all this works on that side. Okay, so I don't want to get. I just want to clear this up because employers may think that they have more negotiating power after this statement, but they really, really don't. And I'm not saying that because I'm trying to be a negative Nancy. I'm actually like a Labrador Retriever. I'm extremely positive all the time, overly optimistic sometimes. And, I don't mean to be a critic. But what I do just want to state is reality, and that is that price transparency is not going to help small businesses negotiate with their insurance carriers. And it can't. Maybe 20 years ago it could, but not in today's environment. And the reason I say that is because we're not allowed to. We can't. We're not allowed to because of regulations. There's regulations in insurance now because of healthcare reform, Obamacare, that came down in 2010 that said, this is what insurance is. This is what it looks like. It has to fit into these buckets. It has to cover all of these things, has to cover, and it has to fit into these plan designs, bronze, silver, gold, or platinum. Okay, and those rates, and they told the insurance companies, you have to fit into these buckets, and this is the definition of each bucket, and it's adjusted every year. And you give us the information on those plans, and then you tell us what the rates are going to be, and then we're going to approve or deny those rates. And those rates have to be filed with the state within a certain amount of time and approved. Okay, so how is the small group employer going to be able to negotiate in that process when it's approved by the state? There is no way. The rate is the rate. And it even says in the legislation that your rate can only be determined by your zip code and your age. That's it. It can't be based off of price transparency. It's illegal. We can't do it. It's not something we can do. Maybe the only way I can see this at all helping small businesses is understanding their risk of going to a level funded plan or a partially self-funded plan. Okay. because the information is a black box right now, okay, we do not have claims information for small group. We don't know what the claims are. So let's say I have a group of 75 in California, and they are not a large group. They're still considered a small group. In California, it's 99 and under, or 100 and under. Okay, so if you have less than 100 employees, you are a small business, and you're with Blue Shield of California. And I get the renewal, and the renewal says it's a 15% increase. I go back to the insurance company and say, why do they get a 15% increase? Because we used to be able to ask, do they have a high claim, any large claims? Is it based off of demographic information of this group? No, it is not based off of the group's individual information at all. It is based off of the zip code of all of the employers in that area and the claims and the claims experience of that area and the projected claims experience for that area in a given amount of time. Okay. So it's not based off of any individual. It's not, it's based off of demographic information in that all of the ages of the employees are taken into consideration, but transparent information, I can't take this study to Blue Shield and say, well, here it says that you're charging, or the hospitals are charging 4 times as much for a CT scan to some carriers and only, $100 for other carriers. I say, so yeah, that's our, choose a different network if you don't like it. Maybe you should downgrade your network if you want to save money. Maybe instead of having 1,000 doctors available in your area, maybe you should let your client know they can have access to 500 and save 10%. Okay, so we have no negotiating power in small group. So wanted to get that off my chest. And then the second is where the price transparency helps us and helps the small business is when we're looking at level funding or partial self-funding or high deductible plans or something like that, okay? So because we have so little information in the last 12 years on what claims are and the claims experience of each group, it's, now it's a black box and we don't know what the claims data is for each of our clients anymore, unless they're over 100, 250 plus employees, then it's a totally different story. I'm just focusing on small business because it's saying not self-insured might be able to use this for price transparency to impose pressures on insurance companies. So not self-insured, and to me means small business, most of it, because small business is forced into not being self-insured. They're not allowed. There's very few instances where they can be self-insured, and it's oftentimes illegal, and they make the stop losses so high that it doesn't make sense because there's legislation around that too, and what your stop losses have to be. But anyway, so if we're going from a self-insured plan to, let's say, a level funded plan, which a small business can do, having price transparency would allow us to understand what the expected claims will be more accurately. We would be able to see the risk and establish, because the more information we have, the more accurate we can be in advising an employer on, okay, let's say you're spending $1 million a year on your PPO with a $500 deductible. If we take you to a $6,000 deductible and we save you 20%, so we save you $200,000 a year by increasing your deductible, and we use that $2,000 to fund a deductible, what is the savings? What are the expected savings based off of the expected claims? So if we have price transparency, we'd be able to understand the expected claims, and we would also be able to understand expected increases, especially if we have year-over-year data. So if we know year-over-year data, we'd be able to track the medical inflation better. Because right now we're just basing it off of what the insurance companies are telling us it is. rather than seeing actual pricing. So we're looking at Kaiser Foundation studies, we're looking at Cigna studies, United Healthcare, Aetna studies, and they're telling us what the medical inflation is, but we don't actually see it with this transparent pricing. And that would be amazing to know. It would be amazing to know rather than just getting it from onesie twosie carriers and here and there, and having it in a bigger, having more information would be great. I agree, it would be great. So yes, but it's so much information, and there's what they're saying is these coders and these programmers are saying, dude, there's a code for every single procedure, and there's thousands of procedures. And then a lot of times these codes are associated with diagnosis codes, and there might be a different diagnosis, and that diagnosis changes the price and the complication of the service or of the procedure, and that can affect it. So how do you algorithmize that? So yeah, it's a lot. So I like that they started with a couple CPT codes. I think that's how you have to do it. I think you have to break it down, looking at primary care visit, right? Nationally, let's look at the primary care visits and figure out what the average is for each area, right? And what the variations are. I like that the pairing that they did here and the ratios they did. Okay, and so in going through this article, there is quite a big range. I didn't find the specific range that was noted in the article headline. So the article headline was, $100 and something up to a range of 4,000. I do see in here in this study, and I'm not going to show it because my intention is not to give away their work. If you want to see the study, it's $30. I paid $30. You can pay $30 if you really want to see it. But the CT exam of the head or brain without contrast materials, CPT code 70450, ranged from $199 to $1,882. And they ranged from the 10th percentile of hospitals up to the 90th percentile. So they took out the most expensive 10% and they eliminated the least expensive 10% in that range. Okay, so maybe that's the range where this article is getting that information. And however, I didn't even see it in the written portions of this study. But maybe it was some other information that was released in their press release. So maybe there was some sort of a press release that the researchers gave, and that's what these article or these media outlets ran with, was the press release. So maybe it's somewhere else. I'm not seeing it, but it's still a staggering range. That's a 10x, so a range almost, like a 9.5x, 199 to 180 or 1,882 for the same procedure. So pretty staggering there. And the Medicare reimbursement rate for that procedure is 137. Okay. So you can see that, some, these hospitals, the very base rate they're getting for these Medicare patients is $137 for a CT scan. They're saying, we can't live off that, so we need to negotiate with these insurance carriers to make up the difference. And that's what's going on. With all that said, I'm not pretending like I know all the answers. I'm empathetic to the doctors and the hospitals having to work with these insurance companies because they're a pain in the butt, but I also understand the insurance company's side of things. It's a pain in the butt trying to figure out all these costs and make sure you have enough money in the bank to cover all the claims and follow all the guidelines and the regulations. So I get that side of it as well. And then I also understand the patient side, because it's very confusing to be a patient and be in the medical system and have to go to the hospital and have to get the CT scan and the MRI scan and go in the ambulance and take all the rides and get all the bills and get EOBs in the mail. I understand that it is extremely complicated, and I'm empathetic to all sides. So with that said, if you want to get a hold of me, I have a link down below. I appreciate you hanging out until the end. Please like, subscribe, make a comment down below, and we will see you next time.